At this time, we are going to open up a discussion just on the results from breakout session 1 and sort of setting the stage as we move into, I'm sorry, for day 1, as we move into our breakout session number 3. Sorry. Speed. And so we're going to be, our third breakout session is going to provide us with an opportunity to revisit some of the points that we discussed during day 1. And in doing so, we'd like to sort of prime that conversation by addressing some of the outstanding questions that you all have. And so I appreciate all of the activity in the chat. We've been going through the chat, centralizing some of the questions that have been asked and are still outstanding. So at this point, what we'd like to do is open up a panel style discussion. We're going to propose some questions, and responses are welcome from all of the prior speakers from day 1, as well as representatives from NSF and from our co-organizers as well. So you have an opportunity to hear from a mix of folks in response to each of the questions. And so if you have a response to the question, you are welcome to unmute yourself, and I'll do my best to moderate to make sure that we're not all talking over each other, as I'm sure we're all excited to participate in the conversation. And please keep in mind that even some of the items that we may not cover in this particular part of the agenda, we'll still have an opportunity to speak to some of these things during the breakout sessions as well. Okay, and so we're going to jump in with our first question. And so this is a general question. An attempt was made to make sure that in this workshop, a diversity of perspectives were incorporated. And as we all broke up into smaller groups, we were able to get a sense for the background of one another before we entered into that conversation. But we're curious to know if you felt that there were missing perspectives in the conversation that you had. Were there any additional perspectives that you would have liked to have seen in the conversation that you were involved in yesterday? So were you sitting there thinking to yourself, wow, I really wish that we had somebody with this particular background to jump in and provide some insights into the conversation. So if there are any moments like that that stick out to you, we'd like to hear your thoughts on who you would like to have had in the conversation and why. Anyone can jump in.
All right, I'll take the bait on that one. As somebody who has been working in this field for about 30 years now, what I was kind of shocked to see was the people that I know who are really most effective at this boundary between basic research and epidemiological modeling. I see very few of them here at this workshop. And so most of those folks that I know come from the ecology and evolutionary biology world. But there's also increasingly, I think, a group of folks in public health. And there was a comment in the chat by Dina, I guess. Is that right? Yeah, Dina Mystery, which kind of suggested, why are we being expected to do all the work of public health? And I think that's an interesting question to actually jump off from and might generate some interesting comments. I don't think that's what we're being asked to do, but I do think that the absence of voices from people who are in that part of the world has made it difficult for us to see that's not what we're being asked to do. So it feels a little bit to me as though people, and I'm just putting this out there, I don't know if this was the driving force, but it's almost as though the folks who organized this didn't want to step on NIH's toes somehow, because NIH is already kind of involved in all that. But I didn't see those folks. So just as an example, there are a lot of people who are now employed, and I'm out here in Seattle, so I'm aware of all of this. A lot of people who are employed at the Gates Foundation now, who are doing this kind of modeling, who've been involved in epidemic modeling since the year dot. There are people at IHME as well who've been deeply involved in trying to navigate between what we can see in data, given the streams that are already out there, and how that can inform the public health response in an actual state here in Washington. And the governor here in Washington actually depended a lot on their projections. So I guess I'm not, maybe you have these in the other NSF workshops, it's possible, and I'm only, seeing this narrow pipeline here, but to me it was very noticeable and somewhat surprising that the group of people that I most expect to see at a workshop like this were not here.
Interesting. Does anyone have any comments in response or to the original inquiry, just concerning missing perspectives in the conversation?
Well, so I would come back, I think, maybe with a question for you, which is, that does actually imply that they wanted to come. We didn't get a lot of folks answering back that they were interested in participating in this meeting. How could we have structured the invitation to attract a better response?
That's a great question. That's really a great question. When the workshop started, I actually wrote to a friend of mine over at IHME and said, how come you're not in the room? And his response was, we are participating in some of the workshops. We always participate when we're asked, or something like that. So I'm not sure. I think partly the people who are most involved in plying that boundary right now are totally overwhelmed because of coronavirus, right?
So that's we, right?
Well, no, I don't think we are in the same way, because as Jim pointed out, I think when you're working on, polishing your abstract, it's a very different timeline than when you're working on getting to the governor tomorrow, whether or not we're going to change the policy on whether restaurants can open up, right? There's a very different time constraint there. So I think the people who are actually engaged on that boundary on coronavirus really don't have the bandwidth, number one. Number two, you guys got this started. I mean, I was stunned at the time frame that you were asking for. Given that if someone is busy, it's hard to fit it in. It made it difficult, I think, for people to respond. So I would say it's very practical things there. I don't, other than dangling $1 million, I don't know that you could have made an invitation attractive under those conditions. Just my thoughts.
If I can make a comment, I think this is intended as seeding subsequent discussion in the context of comments that we are going to receive, not only from the people that participated in this workshop, but also from the broader community. And I think this is more of a call to all of you that know those communities better, to help us reach out to those communities and request comments, request information. We will follow up on that front, so that whatever happens and how this community coalesces, more and more voices are going to be represented.
And again, I'd comment, I think this is reflective of some of our overall conversation around breaking down some of the barriers to interdisciplinary collaboration, right? So we understand there are barriers and challenges. Some of them are reflective of time as well, and understanding the criticality of these efforts in society and in our world today.
I think this is a friendly amendment. There are two areas that I would have liked to have seen more of people that we just weren't able to get, didn't have time, didn't, what have you. But are people doing sort of One Health models of biology interacting with social side? I'm thinking here of folks like Charlie Nunn at Duke, who does work on parasites, for example, which would be, he was just too busy, couldn't make it. And I guess I would have liked to have seen a handful of more MD practitioner types, because I have a cartoon version of what doctors are seeing on this set, and I think that from that problem question side, that might have been useful.
Thank you. We appreciate that. Any other thoughts? Who else do we feel was missing in the conversation?
I think Eric has his hand up. Sorry.
Yeah, so I use a little hand raise emoji because that's what I've been taught recently. And I think in some respects that I am possibly one of the representatives of the people we're talking about. And I think one aspect of it is we are indeed underwater, and there's a lot of people who are underwater. Last night after this was done, I got to answer a bunch of emails about what we do about the fact that we found a bunch of fraternity members and their significant others hiding in some closets from their RA, and that's not social distancing. And it's going to mess up our test positivity rate. And in exchange, that's going to mess up the test positivity rate for Whitman County, which means restaurants can't open, et cetera, et cetera. So I think there is that aspect of there. And I think right now there is an aspect of triaging things. I think another sort of confusing notion for that, and it's something that came up with the various discussions about sort of what the home for this is and where does this live, is since this is put on by a funder, and that funder is the NSF, I think there is sort of a filter of people who feel like this would then be a good use of 2 days of their time. And like I do enough basic research that I think it is. I don't know any clinician that is ever going to get funding from the NSF, unless maybe they're a writer on an EEID proposal. And so I can't get clinicians to answer my emails about their own hospitals right now. So I think, hey, would you come hang out for 2 days with the NSF with some really cool people? Is like, yes, like 8 months from now, there could be a great conference on looking at this retrospectively. And I think that's one of the really hard parts of it, is just those constraints, and then sort of where it comes from this. But yeah, I just wanted to chime in with, I think there is an aspect to wanting those people in the room. I would note, I sort of believe, at least theoretically, I am one of those people, but I think it's really right now sort of a hard thing. And that, yeah, I can see the response rate from those kinds of people being appallingly low. I have joked to Nina that essentially I love Dina and she's a dear friend of mine, which is why I didn't cancel this, because things are happening. And so yeah, that's I think a major part of it is just that same question we've been coming back to over and over again, which is sort of, what is the logical home of pandemic work and what is the incentive for that? I think you will lose, wherever you position that, you lose people at the periphery of that thing. I mean, if we had a CDC funded version of this, I think a lot of the great people here who are doing sensors and machine learning and bioinformatics would go, yeah, but when was the last time a CDC BAA had anything I was interested in? And so I think that's sort of an intrinsic problem.
Great points. We're seeing a lot of agreement in the chat as well. I see a hand raised by Shelby Wilson.
Hi, I just wanted to bring up that, so I am here representing Johns Hopkins Applied Physics Lab. And so since the start of the pandemic, we have been boots on the ground dealing with policymakers and have kind of the opposite problem in that we haven't had time to write a paper, because by the time anything gets done, the next emergency is coming down. So just outside of my personal collaboration with Nina, actually within our organization, actually this workshop was widely advertised. And so I was sent as the sacrificial lamb. I'm really enjoying it, but I will say that it was widely supported within the APL community, and we are operational in nature, both in the pandemic and in non-pandemic times. And it's a pleasure to be here. Really enjoyed it.
Fantastic, thank you. Any other thoughts? I don't see any more hands at this point. Just want to provide a last chance for anyone to weigh on this particular question. Perspectives that you feel we're missing in the conversation. And this has been great too. I think this root cause analysis is very helpful. Okay. So then I'd like to follow up just on a comment that Dr. Moody made, just about sort of having this cartoonish idea of what it is that the MDs do in this regard, right? And I think that's something that's come up in the comments as well, is the idea of these deep interdisciplinary work versus more of a surface level interdisciplinary work. So there were comments along the lines of, it's possible to sort of, learn the language of a particular discipline and maybe pose questions or understand when answers are being asked without really understanding the technical detail of the solutions. And so how do we overcome this? How do we address this? Or are there mechanisms we can use to foster a depth of interdisciplinary collaboration that's productive? Or even what level of depth is productive, right? Thoughts?
If I can try to address that a little. So from my perspective, the reason to work with experts is that they are expert and you're not. So you're not trying to find people who know exactly what you know, who you understand fairly well. The idea is that you can talk to each other, I think. So I don't believe that you need to have the depth that the expert that you are trying to work with has. You just need to understand what the conclusions and the assumptions. So first the assumptions and then the conclusions are in the work that he or she is doing.
Makes sense. Thank you. Any other thoughts?
I'll just pipe in and say my own experience in working with people who have an MD after their name, and it doesn't necessarily mean they're clinicians, but some of them are, is that tends to happen for me in the context of a multidisciplinary center where there is institutional support for ongoing interactions. So that gets back to, again, I think the question of what is the home for this kind of a work and how can you nurture it? And I do think that, so the context in which I'm most familiar is the Centers for AIDS Research, which are funded by NIH. Those have been around for over 30 years now. So it is in contrast to a lot of the centers that NSF funds, which tend to be relatively short in duration, so 5 years or 10 years. This is a 30-year commitment that NIH has made. And the same thing is true about their commitment to the population centers for demography, which are another, I think, really good example of where they have established a culture of interdisciplinary research that is nurtured over the long term, that you can rely on is going to be there next year, right? In the absence of that, many of the centrifugal forces that everybody here has mentioned end up dominating, right? Because there just isn't a way to create the time and space for the conversations that are necessary to actually get people to engage with each other.
I think so sort of echoing what Martina has said, because I work with a lot of clinicians, is that I think that the two aspects you have to have is either, like Martina said, that funding stream, because coming with money is always helpful. Or the other one is answering a problem that they have. And one of the tricky parts there is, and we discussed this a little bit in chat, is what is interesting to a clinician and what is interesting to your field may be extremely disjoint. So to use an example from a recent project, from a computational standpoint, it's a binary classification problem. It's boring. On the other hand, it will untangle a problem a major tertiary care medical center has with figuring out its drug usage rates. But it's logistic regression. And nobody is going to get a PhD in computer science for doing logistic regression. And so trying to come up with how to mesh those things together is important. And then I think one of the things is sort of, when you have a pandemic, building those relationships is already too late. Because if for nothing else, then they're really busy right now. But also a lot of that is sort of building the trust of, yes, you can be trusted to root around in our EHR system and not, get into trouble doing that. And yes, you ask questions that will be applicable, and that this isn't just us spending a lot of time sort of launching things off into the ether. So I think a lot of that is relationship building that is nice if you have a long-term sort of center to support that. But if not, you need to sort of come up with the other ways to help build that. And that involves doing a lot of favors that won't necessarily result in interesting publications in your field. And that having the room to do that is its own thing, which is, shapes decisions that people make.
Just a friendly amendment to what Eric said. I think maybe because NSF they don't have the capacity that NIH does. So this idea, and I think Jim mentioned it as well, of partnering with NIH and figuring out some questions, as Eric suggests, are not going to be appropriate for the kinds of research that NSF would fund, right? You know, getting a logistic regression to work on some existing data set is simply not in the NSF purview. But if there's a filtering process through this partnership with NIH, then some of the questions that don't have good answers already could be filtered to NSF and would be exciting for other people in the academic fields to take on. So that strikes me as maybe a good institutional answer to, you know, how do we filter the problems that are worthwhile to our community and then help to make those problems available for research.
So I am going to speak up just because I'm not sure if people are seeing the little emojis. So I do have a problem with the assumption that logistic regression is not interesting to NSF. From the perspective of that, I don't necessarily know that the best answer to the question you can ask as a clinician is logistic regression, right? So the biggest issue, I think, isn't about choosing necessarily the questions, but explaining your questions that you deem fit to the person who would then solve it. And I think, yes, that requires some sort of a communication or some sort of interaction on an institutional level, a larger scale thing. But in the end, if you know how to solve the problem, that's not a research question, right? The research question is, how do you solve this problem that I have? And I think that part is missing, the communication of the question.
So you've just essentially reframed what I think I was trying to say, which was, in some cases, logistic regression actually is the answer, and those aren't and we need a way to filter those questions out. They need to be answered, and there probably is a role for some level of academic involvement there. It might be bioinformatics, right, not computer science. And the problem with us, now I use this as our general community, is when we get a question like this, it takes a while to answer, right? And so that may not fit within the time scale of the governor needs an answer tomorrow. And so we need to figure out how to manage that expectation. And, you know, it's taken our lab 25 years to put together the methods that we can now use to answer some questions, right? 25 years is a long time to wait for an answer.
That depends on the question.
Definitely. I'd like to, in the time that we have
Answer's
remaining
42.
for the panel, I'd like to quickly turn our attention to another topic that has come up prominently in conversation, and this is the availability of data and the use of data within different models within this field of research. So, you know, as we know, much of this research is influenced by social and behavioral data related to humanity, its movements, its actions, and its interactions. So we had some questions on separating the research value from the commercial value of data that's available, right? And a lot of conversation came up yesterday around privacy concerns, access, communication. And so we understand there are definitely complex considerations around data. But one thing that we know is much of the data that is useful is held in corporate hands nowadays, right? So are there mechanisms or approaches that can be used in order to separate the commercial from the research value of data to still make it available for use in research?
Well, I can expand a little bit on that. I mean, we're all well aware of issues of privacy. And what I'm thinking about is issues of proprietary information. So sometimes you might not be able to get a cell phone data set because the company doesn't want its competitors to know what's in the data. And the only way I can think about this is that someone has to build a model of the data that captures all the relevant information that researchers would want to use and make that model available to other researchers. And then you get into all the usual questions about the validity of the model and whether or not it has sufficient statistics for actually doing the research other people want to do with it. But so I was just wondering if anyone has experience doing this thing, if it's something that the NSF, if it's like a program the NSF might want to sponsor.
So just to build on that, there was actually a large program of basic research for privacy preserving transformations of data sets, partially using techniques from zero knowledge proofs, but also partially using techniques from one-way hash functions, where you could query the construction of the transformation of a data set in a way that was consistently and provably uniform over a particularly specified question, but that would have obfuscated other main features of the data set. The problem that we ran into, and this was a long time when I was playing with this, like the late 90s. And this was done by industry, not by academia. This was done by industry for exactly the reason that you're talking about of communication privacy around consumer bases for industrial clients. And so I think it's still an open question, but forgive my naivete if it has been solved since. But I think where we got stuck and hasn't been solved since is that the restriction it placed was you had to know exactly what you wanted from the data. You couldn't do discovery-driven interrogation. You had to ask that very specific question, and then everything else would get obfuscated, and you couldn't make the connections well. Maybe that's a thing that we as a community also can contribute to, and maybe the narrowness of it being about epidemiology might help us restructure some of the nature of those queries in ways that allow something a little bit more viable about the strict privacy of the single question. Does anyone else on the call work on anything like this these days?
I'll echo the same frustration with having to have a single question to get access and being denied the ability to poke around. Some kind of sandbox that makes it possible for people to do that, and particularly if we're going to answer the social integration with related, social determinants of health kind of questions that we're interested in at the intersection here, we've got to have that to do it.
There is work on this. It's not my specialty, so I'm not going to cite chapter and verse, but if you go look at the current literature on distributed learning and federated learning and privacy preservation, there's a lot of work in machine learning on this issue, a lot of motivated by drug discovery. So companies that have they have proprietary databases that they want to keep secret, but people want to be able to do all sorts of discovery queries on that. And anyway, there's a lot of attention to that problem. So there's literature out there to say it's not my field, but
have they solved the discovery versus interrogation question? Because yes, there is this literature.
It depends what you mean by solved, I think, right? There are certain kinds of attacks, and then there are certain kinds of queries that you can make that are not vulnerable to certain kinds of attacks. I couldn't tell you the exact chapter and verse on exactly what is currently solved, and also for what time complexity, and the like. But yeah, this is a very active area of work. There's a lot of stuff being done in computer science on this.
So I know for a fact that if you wanted a data set in its complete essence, or all of it, you couldn't have it, no matter what. So you could design a query, which would require you to know a question you're asking. And yes, as Carter explains, that you can actually access records in order to get information about whether something that you're looking for is there. And then you can further communicate with whoever has those records to try to get whatever data you're looking for. And you can more explicitly build machine learning models on top of this data that you never see. But that's a lot more complicated, and not every hospital has the ability to provide that interface.
This time, I want to just thank everyone for their contribution to this conversation. And I want to just remind everyone that our closing discussion, or our final discussion at 4 p.m. today is going to be similar in format. So if you enjoyed having a voice in the conversation and having a conversation structured like this. Don't worry, we will continue this later. So there will be an opportunity to address more of the outstanding questions and to continue the conversation that we're in right now. And so that will occur after breakout session number 3. At this time, though, I would like to reintroduce to everyone Dr. Katerina Dittmar, who's the Permanent Program Director in the Division of Environmental Biology in the Systematics and Biodiversity Sciences Cluster, the Ecology and Evolution of Infectious Diseases Program, and the Dimensions of Biodiversity Program at the National Science Foundation. And so we are coming to very shortly to the close of the webinar portion of our workshop for today. And so we'd like to welcome Dr. Dittmar with some closing remarks.
Thank you. I really just want to take this opportunity to thank you all very much for volunteering your time. I know this has been an intellectual tour de force. We are on workshop 3, and I'm really grateful that you are able to attend not just one workshop, but many of you I've seen in the other workshops as well. And I've heard a lot of very creative contributions, very meaningful contributions for us. The purpose of these series of workshops really is to get the communities that are perhaps not normally talking about this in a cogent fashion together, start building some networks. And I hope that this has not only been important and interesting to us, but also to you personally, and you were able to make some new connections. Having gone, or before I remark a little bit on perhaps some particular theme that I've been hearing, I'd like to remind everyone that we are not done yet. There is another workshop coming up, and I will be posting this also in the chat function. So on March 22nd to 23rd, there is workshop 4 of this series, which will deal with the examination how human attitudes, social behavior, and the drivers underlying both of those contribute to disease transmission. And I hope that at least some of you can make it to that one as well. Now we are on workshop 3, and there are very clear themes that are starting to come out. I'm not going to repeat them all. You have done a great job at actually touching on pretty much all of them. But a lot of those themes are tricky questions, and they all sit on this kind of intersection of domain sciences. Some of them are problems that are also relevant in contexts outside of a pandemic. In other words, there are deep problems that we not only have not solved in the context of a pandemic, but also in a set of other questions that we especially are interested in at the National Science Foundation. And the reason that is and perhaps important observation is because we are coming back a lot to this theme of how do we sustain momentum in this process, and how do we sustain and connect it in interdisciplinary community that can prepare us in general, not just better to respond to a pandemic, which is our most critical problem right now, but a lot of the themes that you touched on are really fundamental problems that kind of bleed into other disciplines. And they are all areas and domains that NSF funds. So there's a lot of opportunity for us in just listening to you to perhaps think about how some of these areas that you identified could be better supported in already existing programs and opportunities that we have at NSF. But aside from that, we are currently, and I cannot give you specific details, but the idea really with this effort, with these workshops, is that we are in the process of developing funding opportunities that will rally around this general theme of pandemic predictive intelligence preparedness. And the idea is that we will hopefully have some funding opportunities in the short run, but also on a longer perspective that will specifically allow teams of researchers to drill into some of the questions that basically emerged already from the workshops. So I just ask everyone to stay tuned, and we will obviously stay in touch and communicate any opportunities immediately as they come up. But that's kind of the extent to which I can give you some information. But the idea is that this is not going to stop with the workshops, but that hopefully some more sustained funding opportunities will come from this. And with that, again, I can't tell you how much I would like to thank you. It's been a pleasure, and I've enjoyed it tremendously. And I think you've really done a great job in kind of centering in on some of the hard questions. So thank you.
And thank you as well. We definitely appreciate it. It's a virtual applause. I don't think there's a good button for that in Zoom yet, but I'm sure somebody's working on that. Thank you so much. I'd like to just take a quick moment now before we break for lunch, and we do have about an hour to do so. I want to take a moment just to provide some quick instructions regarding the breakout sessions again. So the Zoom link has not changed for the breakout session. So you can use the same link that you used yesterday in order to access the breakout sessions today, okay? And if anybody does need a reminder on that, or if you never received that link, then you can always send an email to the Energetics team, and we'll make sure that you have that information. And so let's see, one of my colleagues should be providing a link in the chat for email address in the chat that you can send an email to if you do require the Zoom link to enter into the breakout sessions. So the breakout sessions this afternoon are not going to be divided into themes. And so you don't have to worry about picking your group this time. We do, however, encourage you to join the Zoom meeting quickly before you go ahead and take your lunch, and that'll help us to make sure that folks are evenly distributed between the different groups that will be discussing in parallel. So we're going to conclude here in the webinar portion of the agenda. So you're welcome to leave from this webinar and to meet us in the Zoom meeting. We'll keep this open just for a few minutes for anyone who needs that email address. But otherwise, I just want to say thanks again to everyone for NSF for sponsoring this event, for putting the support behind it, for all of the co-organizers for your work in helping to make this a reality. And to all of the staff, to everyone who has supported this in the background, from IT, communications, the broadcast, the management of it. There are so many amazing people who have coordinated in order to make this happen, including all of you who have attended and brought your unique perspective and experience to this conversation. So thank you to everyone. We look forward to continuing the conversation in the breakout with those who are able to attend, and to those who aren't able, stay tuned for more to come from NSF on this important topic of research. Okay, thank you everyone, and we'll see you soon.